Bonjour, Tansei, Watie, How, and Lanite. Hello and welcome. This training video is presented by the Speech and Language Special Education team at the Manitoba First Nations Education Resource Center. My name is Chelsea Alexiak, and I'll be taking you through the first part of the presentation, and then you'll hear from my colleague, Susan Jansen. Today we're going to discuss the difference between hearing and listening, the cause of listening difficulties, the skills needed to be a good listener, and how to help your students listen to learn. We'll also give pointers to strengthen both the speakers' and listeners' skills. Although we use listening and hearing interchangeably, they are not the same thing. Hearing is a sense. Listening is a learned skill. Hearing is a process, function, or power of perceiving sound. Hearing is accidental, involuntary, or effortless. Listening, on the other hand, is paying attention to a message in order to hear it, understand it, and physically or verbally respond to it. Right now, you may be hearing different sounds in your environment, but I want you to focus in and listen to the different sounds. What do you hear? Can you pay attention and actually listen? It takes more than just your ears to listen. You have to make a conscious choice to pay attention and listen on purpose. Do you hear music? The dishwasher? Sirens? Wind? A clock? Let's think about music. Are you someone who enjoys playing music in the background throughout the day? You may be hearing the music, but you're not always listening to the music. Try to listen to one of your favorite songs. Pay attention, on purpose, to the instruments, lyrics, and tone of the song. Give the song your full attention and really enjoy the experience. Some of the students you work with might be hearing your instruction in the classroom, but they might not be listening. You might sound like the teacher on Charlie Brown to them. If you've ever watched it before, she sounds like wah, wah, wah when she's talking. They might be hearing your voice, but they might not be comprehending a word you're saying. Remember, listening is a learned skill. It takes effort. So why is listening so important? Listening is a very critical part of communication, as much as speaking clearly and choosing the right words. One person sends a message and another receives it. Talking to someone who is not paying attention or listening is frustrating, as we may have to repeat things over and over without getting an adequate response. The person or receiver with poor listening skills may misunderstand the message, therefore creating frustration. A child with listening concerns can test your patience, but you have to remember the child is equally frustrated. Parents may interpret behaviors resulting from their child's frustration in communicating as ignoring you, not paying close enough attention, just being silly, or acting foolishly. A child having difficulties with listening skills is more likely to have difficulties coping in classroom situations because the majority of information teachers deliver to students is auditory. Imagine your child's frustration when he or she walks into the classroom and hears, "Students, please hang your jackets in your cubby and unpack your backpack. But before you hang and unpack your backpack, please come give me your lunch order. If you brought money for your field trip next week, please put it in the red basket on my desk. Make sure to sharpen your pencils before you sit down to do your seat work. When you finish your seat work, put it in your blue reading folder. Get out your reading book and wait for me." Wow. In order for a student to listen and follow those directions, several skills are needed. Can you think of any? We'll break this down further later on in the presentation. Have you ever thought about how we hear sounds? It's pretty incredible. Sound waves travel from the source of the sound, such as the speaker, to the outer ear. The air continues through the ear canal to the eardrum and causes it to vibrate. The vibration of the eardrum triggers the bones of the middle ear, so the malleus, incus, and stapes, to move up and down. This movement creates waves in the fluid of the inner ear or cochlea. Tiny hair cells bend in the cochlea and stimulate the auditory nerve, which transmits the auditory information to the brain. A breakdown in this system results in a hearing loss. Hearing loss directly impacts a child's ability to communicate. Children develop language and speech by hearing and imitating sounds in their environment. Therefore, a child that cannot hear all the sounds in his or her environment has difficulty understanding, communicating, and learning about the world. Causes of hearing loss vary from genetics to infection to injury. Children may be born with hearing loss or acquire the loss during infancy or childhood. An audiologist or otolaryngologist, so an ear, nose, and throat doctor, can help determine the significance of a child's hearing loss and any treatments available that would benefit the child. When a child receives a diagnosis of hearing loss, the audiologist determines the type and severity of the loss. Hearing losses can be conductive, sensorineural, or mixed. Severity ranges from mild to profound. Conductive hearing loss happens when the auditory signal breaks down at the outer or middle ear. This may be due to temporary conditions such as fluid buildup in the middle ear infections such as otitis media, or wax buildup in the ear canal. Other children may have malformations of the ear or ear canal that cause breakdown of auditory signal. Medication or surgical interventions can often treat or remediate conductive hearing loss. Sensorineural hearing loss results from damage or malformation of the inner ear or cochlea. This type of hearing loss is typically permanent and often medical or surgical treatment cannot remediate the issue. Children with sensorineural hearing loss can often benefit from wearing amplification systems such as hearing aids or cochlear implants that can amplify the auditory signal or bypass the damaged inner ear. Mixed hearing loss consists of some combination of conductive and sensorineural components of hearing loss. To determine the severity of a hearing loss, audiologists measure a child's detection of sound at a variety of different pitches and loudness levels. They refer to the pitch as frequency and loudness level as intensity. The audiologist creates a graph called an audiogram that shows the severity and shape of the child's hearing loss, the loudness levels at each frequency the child needs to hear. Hearing loss can be mild, moderate, severe, profound, or a combination of these. A child with a mild hearing loss may have difficulty hearing soft speech or conversational speech when there is background noise, such as in a restaurant. A child with moderate hearing loss may have trouble hearing normal conversational speech. A child with a severe hearing loss may have difficulty hearing loud speech and environmental sounds, such as a vacuum cleaner. A child with a profound hearing loss may not be able to hear loud speech or louder environmental sounds, such as a dog barking or even a lawnmower running, without some type of amplification. Detecting hearing loss. What's the hurry? Typically, our sense of hearing develops before we are born. During gestation, babies are able to respond to sound as early as the fourth or fifth month of pregnancy. Research suggests that babies learn to recognize their parents' voices and may benefit from music they hear before birth. After birth, newborns will startle to loud noises, quiet when they hear their mother's voice, and their own cries, gurgles, and coos. Quickly, they learn to search for sounds around them and begin to attach meaning to these sounds. Like a beep from the microwave means a bottle is coming. Take into consideration babies who have a hearing loss. The amount of auditory input or the hearing experience during gestation is minimal, if not completely absent. Babies who have a hearing loss may not learn the sound of their parents' voices before they are born. As newborns, they miss invaluable auditory experiences. They often do not hear their own vocalizations or quiet to their parents' voices. While most infants search and explore their world visually and auditory, those with a hearing loss explore only visually, therefore missing auditory experiences such as a mom's soothing lullaby. Fortunately, most hospitals now have universal newborn hearing screening programs. These programs mandate or give parents the option of having their newborns hearing screened for possible hearing loss within 2 weeks after birth. Since the implementation of these programs, many technological advances are making it possible for researchers, audiologists, and other medical professionals to obtain and provide hearing aids for infants as young as 4 weeks of age. The Joint Committee on Infant Hearing recommend that all babies with hearing loss receive appropriate intervention services by 6 months of age. Research shows a significant difference in the development of deaf and or hard of hearing children who wear amplification and or receive services prior to 6 months of age. By 6 months of age, babies with normal hearing recognize and react to different tones of voice, so friendly versus angry, and turn to see the source of sounds they hear, the dog, the television, a sibling. They babble, coo, gurgle, and laugh in play and in an effort to communicate. A deaf or hard of hearing baby who begins to wear hearing aids at 6 months has probably stopped instinctive cooing and babbling due to lack of auditory reinforcement. The only peaceful, quiet world a child knows suddenly becomes a noisy, startling, and confusing place. The dog barking, the telephone ringing, and even mom's voice can be strange and unwelcome. These sounds hold no meaning for the infant, who is hearing for the first time. The baby may cry or startle to an unfamiliar noises rather than look for the source. The baby must begin from a hearing age of 0, which is 6 months behind his or her peers. Now that the child can hear sound, it is the responsibility of an early interventionist and the parent to teach the child how to listen. The parents and interventionist must help the child learn to look for the noise, attach meaning to the sound, and begin to vocalize in sound play with his or her environment. Too often, parents or doctors do not detect a hearing loss early. To demonstrate the impact that hearing age has on a child's speech and language development, consider the child who is 2.5 years old and has a hearing loss which goes undetected until he or she is 18 months old. After several evaluations to confirm the hearing loss, she finally receives hearing aids at 24 months. At 30 months old, this child has a hearing age of 6 months. She is able to search for sounds to make sense of the noises similarly to a 6-month-old baby. She is 24 months, or 2 years, behind her peers in the ability to understand and respond appropriately to sounds in her environment. Her peers at 2.5 years old understand more than 500 words and use many strings of words to communicate. Early intervention refers to services provided by specialists to infants and toddlers up to 3 years of age. For children with hearing loss, the purpose of early intervention is to teach them that listening is important and meaningful, how to make sense of the sounds in their environment, to develop their speech and language at a quick rate in an effort to close the gap between the child's chronological age and hearing age. In order to close this gap, a child with a hearing loss needs auditory training. Auditory training refers to the type of intervention necessary to develop the auditory, so the hearing channel in the stages of awareness of sound, detection of sound, identification of sound, and comprehension of sound. For a child with a hearing loss, the early intervention team may include a speech-language pathologist, a special educator, or other hearing specialists, so like a sign language instructor, ear, nose, and throat doctors, etc. This group of specialists work with the child's family to create the best possible listening environment for the child. This may include using amplification, such as hearing aids or a cochlear implant, as well as providing a language and listening-rich environment. For children whose goal is to use speech and understand language auditorily by hearing it, early interventionists will help families encourage their children to learn to listen. Research shows that children with identified hearing losses who receive intervention by 6 months of age later demonstrate better language, speech, and reading performance. Many services and support systems exist for families dealing with hearing loss. Early detection of hearing loss and appropriate services can give children the chance to develop speech, language, and reading skills along with their normal hearing peers. Listen carefully and pay attention are commonly used by teachers and school staff around the country. Parents also use variations of these phrases around the world. Paying attention and listening to others are not only considered essential for social communication, but also for learning to be a part of a group for academic success. Keep in mind that the students you're working with might not understand what you mean by listen carefully and pay attention. It's important to teach these skills and talk to the students about what you're looking for and ultimately asking them what to do. Although we can easily agree that the ability to listen is important, listening involves more than hearing with our ears. So how is this multi-layered skill best taught? To make listening more concrete and teachable, speech pathologist Suzanne Poulet-Truesdale came up with a powerful concept known as whole body listening. This tool breaks down the abstract concept of listening by explaining how each body part other than the ears is involved. The brain thinking about what is being said, the eyes looking toward the speaker, the mouth quiet, the body facing toward the speaker, the hands and feet quiet and kept to oneself, Truesdale stresses that the most critical part of whole body listening takes place in the brain. She states that when we are asking someone to think about what we are saying, we are in essence asking for the listener's brain to be connected and tuned in. This is one visual you could use to teach whole body listening. So the eyes are quiet, the mouth is quiet, legs are folded and still, brain is thinking, ears are listening, hands are to myself. When children struggle to meet classroom standards related to listening and following directions, they may be misunderstood or possibly labeled as having a behavioral problem. According to their age or stage of development, we expect children to learn how to focus, listen, and follow directions intuitively, using the built-in social regulation sense we assume all children possess. However, some children don't intuitively acquire the social skills and self-regulation that we typically associate with listening. To support these children, parents and teachers need to take a step back and view the situation through a different lens. Dr. Ross Green, a psychologist, suggests that we ask ourselves, does the child have the skills needed to perform the task? He states it perfectly. Kids do well if they can. Green believes that it is our job to figure out in which areas our children need support, understanding, and/or accommodations so that they can do well. To explain listening in a way that makes sense, a host of social, cognitive, and sensory processing skills may first need to be concretely taught. And in some cases, children with social learning, sensory processing, attention, or other regulation challenges may not be able to perform tasks generally associated with listening, such as keeping one's body still, making eye contact, or staying quiet. So always, always, always keep that in mind. Kids do well if they can.
There are a number of different components that play a part in being a good listener. We need to be paying attention to what is being said. We need to be able to process the auditory information and language or vocabulary that's being used. We need working memory to remember the message, and we need to be motivated to listen and understand the information that's being given. Next, we're going to go into each of these components in a bit more detail. The first component is attention. In order to listen to what someone is saying, we need to be paying attention. Attention deficits or difficulties arise when the brain is trying to work on multiple tasks at the same time and it can't attend to a message long enough to process it. We might think we can multitask, but for example, if someone is speaking to you while you're also reading something, you're going to lose some of the information in the message. The brain has to focus on one message for a long enough time to process and understand it. Attention deficit disorder is a common neurobehavioral disorder, and it affects a person's ability to pay attention. Students who have difficulty with maintaining attention benefit if you make sure you have their attention before you start speaking to them, and that actually goes for all students. Ways to get their attention before speaking to them include getting face-to-face and making eye contact. If the student seems to be doing another activity or daydreaming, get close or touch his or her shoulder and make eye contact to ensure you have their full attention. You could also decrease distractions. Reducing background noise can be a big help as background noise impacts everyone's listening. Think of how hard you have to work to pay attention to someone who is speaking in a noisy environment. You can also say the student's name before you give a direction or task, or before asking them a question. Using someone's name usually alerts them to the fact that they're being spoken to. You can also use framing statements. They let the student know that you have something to tell them. So you can also combine framing statements with using the student's name. So for example, you could say something like, Ben, I have a question for you, or Isabel, I have something important to tell you. The next component that we need for listening is auditory processing. Auditory processing is what happens when your brain interprets and makes meaning out of the sounds that you hear. It's not the same as hearing. Someone could have normal hearing but have more difficulty interpreting the information they hear. They might have trouble localizing sound or following oral instructions. It may appear that the student isn't paying attention, but in fact, processing the auditory information can be hard work for the student and may cause them to fatigue easily. Auditory processing disorder is a disorder that can be diagnosed by an audiologist, but this is not to say that everyone who has difficulty with auditory processing has an auditory processing disorder. And in fact, all students can benefit from many of the same strategies that can be helpful to a student who may have difficulty with auditory processing. Students who may have difficulty with auditory processing benefit from additional support when following oral instructions, especially if it's long instructions or multiple steps. It helps to break up those steps into smaller parts or give them some additional time between completing multiple steps. Students will benefit from support when sequencing events or pieces of information. So this could be information like a story or even the events in a daily routine. It's good to support students in recognizing subtle differences between sounds or words. So for example, phonological awareness, or especially phonemic awareness, which focuses on the sounds letters make, can be particularly difficult for these students, and they would definitely benefit from additional time and support when working in these areas. And when working in background noise, students may need information to be repeated or additional time to process the information. So what are some strategies we can use to help these kids? And again, these are helpful strategies for all students. Use visuals. Have pictures or symbols or even written keywords depending on the grade of the student. This can be helpful in bringing the student's attention and clarifying key information. Adjust classroom seating so students who may have auditory processing difficulties are close to the person who's speaking. Reduce background noise by putting pads on the bottom of chairs, adding carpets, turning off background music when delivering instruction, and waiting for other people to stop speaking before delivering the information. It can also be helpful to use a sound system. There are sound systems that allow the teacher or the speaker to wear a microphone, and then their voice can be amplified, which helps the student to hear audio information more clearly. The next component of listening is language processing. Language processing refers to how we use words to communicate about our experiences and the world around us, and how our brains process or understand those words. You need to understand the words in order to understand the message. Vocabulary includes understanding the concept of the word as well as how it relates to the other words around it. So auditory processing, which we just talked about, refers more to the understanding and processing of sounds, whereas language processing is referring specifically to how we understand and process words and sentences. Some students may have a harder time with language processing. Think of the brain as a filing cabinet. Each file folder is full of all of the knowledge and words that you know about different topics. So you might have a folder on dogs, a folder on plants, and a folder on transportation. A student who has more difficulty with language processing may be missing some of those folders, or the information in their folders might be mixed up with other folders. This can make it harder for that student to follow oral instructions because they may not have understood all of the information, or they may have found some of that information confusing. When following multi-step directions, they might benefit from more explicit teaching of new vocabulary words or more complex sentences. And they may need supports when joining into a conversation because there is a lot of language used in conversation and it takes a lot of work to keep up with all of that information. We can help build and organize students' language processing by using visuals. So drawing pictures of words and using symbols helps build students' understanding of a wider number of vocabulary words. We can also explicitly teach vocabulary words. We can't assume students understand even very frequently used words. It helps to explain the meaning of the words and then even have the student draw a picture of what that word means to them so they get additional practice learning the new word. When you can, provide short instructions, and if instructions are long, pause or give small breaks between the steps of the instructions and check for the student's understanding. Stand face to face with the students when speaking. So much of our language can be in our body language. Your facial expressions and body language can help clarify information for the student, and standing face to face will also allow them to hear you more clearly. Working memory is the next component that we need to be good listeners. Working memory is the memory needed to hear something, remember it, and then use it to complete a task. So this could be like answering a math question. When you hear the question, do the calculation, and then give the answer. It's also used when participating in conversation. So if someone asks you a question like, how do you get to this school? You need to be able to remember the question, think about the directions, and then explain those directions to the person. Ways we can help someone with working memory include using visuals, which is very similar to the recommendations given for auditory and language processing. The student could even draw an image or symbol of what a concept means to them, or you could ask the student to make a mental picture of the concept. This gives them an additional way to remember the information, both verbal and visual. Repetition is really important for memory. The more you hear something, the more likely you are to remember it. And provide instructions in shorter chunks so there's less information for their memory to have to process all at once. The last component of listening that we'll talk about is motivation. We listen most effectively when we're motivated. We can be either intrinsically motivated or extrinsically motivated. Intrinsic motivation is when you are genuinely interested in a topic or you see its relevance to your life. This is a more sustainable, long-term type of motivation. So if you can tap into a student's intrinsic motivation, you're more likely to keep them engaged. This type of motivation requires you to know your student and their interests. Extrinsic motivation refers to when you're motivated by an external reward. So for example, getting a prize for completing an assignment or getting good grades, those can both be extrinsic motivators. These types of motivators can change a student's behavior more quickly, and it doesn't require you to get to know your student's interests, but the benefits tend to be more short-term than with intrinsic motivation. Ways that we can help increase students' motivation can include recognizing students' positive work and contribution, so displaying their work, sending positive notes home to let their family know about their positive contributions, and even just giving the student a compliment. Small acts of encouragement and positivity can go a long way in motivating a person. Ask students to voice what excites them or what interests them. So for example, if they love video games and they can do a writing assignment or art project surrounding their favorite video game, they're more likely to be motivated. Tie classroom activities to real life. If the students see the relevance in their own lives, they're more likely to be interested in the topic. So for example, land-based activities can be motivating because they're relevant to the student's everyday life as well as their culture and sense of self. Create short-term goals and include self-evaluation. If the student can reflect on their own progress, that can help foster intrinsic motivation and also helps you to get to know more about your students. Finally, if you show enthusiasm for a topic, that will rub off on your students. If a topic is boring to you, it will be boring to your students. If you're excited by it, they're more likely to be excited by it too. Because motivation is so important in developing our listening skills, it can be great to work on developing students' listening skills through play. Some games that target listening skills can include a game like Simon Says. So that's when the leader says, Simon says, and then a direction like clap your hands, and then everyone has to clap their hands. If the leader does not say Simon says before giving a direction, then the direction is not to be followed. So if a person follows the direction without hearing Simon says first, they're out of the game. This game works on attention and following directions. Treasure Hunt works on building vocabulary or language processing and following directions. So you can hide a prize or multiple small prizes around the room and then give the students directions to follow to find the prize. So you can incorporate silly suggestions like spin around 3 times or crawl like a bear as you're giving them the long directions to find the prize. It would be like a silly obstacle course to find a treasure. For the cleanup activity, you can practice giving and having the students give you or each other directions during cleanup time. They can take turns telling a partner what to do and follow their partner's directions. Or you can tell the students what to do during cleanup time, and then they can tell you what to do during cleanup time. Students tend to love giving adults directions. You could also go on a sound hunt with your students. So take a walk outside and talk about all of the different sounds that you hear. Have them go to different areas of the playground and then compare the different sounds that the different students hear in different areas. Finally, reading to children is one of the biggest helps in building strong vocabulary and listening skills. Students of all ages benefit from being read to. While reading, ask the students lots of questions about what's happening in the story. So for example, how do you think the character feels right now? Or what do you think will happen next? This helps to engage the students and allows them to participate in the story. So in summary, we talked about hearing versus listening and how it's important to recognize the difference and if a student may have a hearing loss and how we hear. We also talked about some tools to help support whole body listening and listening for learning. The different skills that we need to be good listeners, so attention, auditory and language processing, working memory, and motivation, as well as some strategies to assist students who may benefit from additional supports to build their listening skills, like using visuals and breaking up longer instructions into smaller steps. Ekose, Kinaskamatin, Kinanakaman, Masi, Miigwech, Padamaye. If you have any questions about this presentation, please talk to the speech-language pathologist assigned to your school, or you can email us at speechandliteracy@mfnerc.org.